Good evening and welcome to News Night. I'm Amrit Pal Singh. Over the next 1 hour, we'll tell you what happened in the country and around the world. Well, the government has taken some major decisions to deal with the surge of COVID situation. Cases are rising by the day and the situation is really grim, and therefore it becomes incumbent upon us to maintain social distance, adhere strictly to COVID protocols if we don't want the situation to deteriorate further and cause the sort of discomfort that it did when the lockdown was imposed the last time around. Many states in the country have imposed weekend lockdowns to deal with the situation. Tonight is another night of weekend lockdowns in places like Delhi, from where we are broadcasting this newscast, and also other places, many places in Maharashtra, Chandigarh and other places. So while the situation is that, the government is taking steps to deal with the situation at their level. But remember, following the COVID protocols and getting ourselves vaccinated if we are eligible for it is the only way we can deal to defeat with this virus. We'll tell you about that and also about the campaigning for the rest of the phases for the election-bound state of West Bengal. That and much more over the next 1 hour. Let's begin with the headlines we are tracking at this hour. Major step by the centre. Government sanctions installation of 162 PSA oxygen plants at the public health facilities in all states, as 59 more of the 162 sanctioned PSA oxygen plants will be installed by the end of April and remaining 80 plants to be complete by the end of May. 3 lakh vials of Remdesivir to be supplied to the open market daily. Union Minister Mansukh Mandavia says the central government is working continuously to ensure that the production of antiviral drug is scaled up as soon as possible and its prices are reduced. Railways is getting fully ready to transport liquid medical oxygen and oxygen cylinders across key corridors. Prime Minister Narendra Modi reviews the Covid-19 situation in Varanasi via video conferencing, takes stock of testing, availability of beds, medicines, vaccines and manpower, directs officers to provide all possible assistance to the public expeditiously, says administration should extend all possible help with utmost sensitivity. The world battles Covid-19. India's cumulative vaccine coverage exceeds 12 crores with over 26 lakh doses given in the last 24 hours. 8 states account for 59.5% of the total doses given so far in the country. India's cumulative recoveries stand at 1 crore 28 lakh 9,643. More than 14 lakh affected worldwide so far by the deadly virus, which has so far claimed 30 lakh 26,000 lives globally. The United States continues to be the worst affected country by COVID-19 pandemic. So far, more than 3 crore 23 lakh people have tested positive for COVID. Over 5 lakh 80,000 people have died of the virus in the United States. Brazil remains the second worst affected in terms of fatalities. And in sports, Deepak Punia bagged silver at the Asian Wrestling Championship in Almaty in Kazakhstan, loses to Olympic champion Hassan Yazdan in the 86 kg final. Sanjeet wins bronze. So those were the headlines we were tracking at this hour, and now the news in detail. Well, let's begin with news related to the COVID situation. To deal with the rising cases of COVID infections in the country, the government has taken key measures to deal with the surge. Let's take a look.
Amid rising COVID-19 cases across the country, Union Health has assured all possible support to state to fight COVID-19 by taking steps to double Remdesivir production and supply, ensuring uninterrupted supply of oxygen, continuous supply of COVID-19 vaccines and enhancing healthcare infrastructure. Union Health Ministry on Sunday said that 162 PSA oxygen plants have been sanctioned for installation in public health facilities in all states, and these will augment medical oxygen capacity by over 154 metric tons. In a tweet, the Health Ministry said, out of 162 PSA plants sanctioned by the centre, 33 have already been installed, 5 in Madhya Pradesh, 4 in Himachal Pradesh, 3 in Chandigarh, Gujarat and Uttarakhand, 2 each in Bihar, Karnataka and Telangana, and 1 each in Andhra Pradesh, Chhattisgarh, Delhi, Haryana, Kerala, Maharashtra, Puducherry, Punjab and Uttar Pradesh. In addition to 162 plants already being sanctioned, states have requested the centre for more than 100 additional plants which are also being sanctioned. Prime Minister Narendra Modi on Saturday had taken a review meeting to ensure adequate supply of medical oxygen in the country. PM had asserted that it is important to ensure synergy across ministries and state governments to maintain the adequate supply of oxygen. He had directed to increase production of medical oxygen to fulfill the growing demand. The government has said that 100 new hospitals will have their own oxygen plant under PM CARES Fund, and another 50,000 metric tons of medical oxygen will be imported for easier availability of essential medical equipments and oxygen. Indian Railways has said it will operate special Oxygen Express trains for the transport of liquid medical oxygen and oxygen cylinders. Railways said that a green corridor is being created to ensure fast movement of these Oxygen Express trains, which will ply after the completion of technical trials.
6,177 metric ton, 6,177 metric ton oxygen हमने अलग अलग राज्यों को उपलब्ध कराने का आज पूरा प्लान फाइनल कर दिया है और हर राज्य के हिसाब से इस ऑक्सीजन को अलॉट किया है जो आगे चल के महाराष्ट्र, दिल्ली, उत्तर प्रदेश, राजस्थान और अब तेलंगाना, आंध्र प्रदेश, उत्तराखंड अलग अलग राज्यों के हिसाब से कितना एक एक राज्य को किधर से जाएगा ये मैपिंग आज पूरी तरीके से की गई है.
The centre also intervened to make Remdesivir more affordable for patients. 7 companies licensed to make the drug in India have lowered their prices by 25 to 70%.
रेमडेसिविर इंजेक्शन का प्रोडक्शन देश में जल्दी से जल्दी बढ़े और उसकी प्राइस कम हो, उसके लिए भारत सरकार की ओर से प्रयास हो रहा है. आज के दिन में पर डे 1.5 लाख वाइल का प्रोडक्शन होना स्टार्ट हो चुका है. अगले 15 दिन में वो बढ़ा के डबल हो जाएगा, यानी कि पर डे 3 लाख वाइल का प्रोडक्शन हो जाएगा. एग्जिस्टिंग 20 प्लांट से बढ़ा के नए 20 प्लांट को भी प्रोडक्शन की मंजूरी दी गई है. अगले दिनों में हम कोशिश कर रहे हैं कि मैक्सिमम से मैक्सिमम रेमडेसिविर इंजेक्शन का प्रोडक्शन हो. दूसरा, प्राइस कम करने के लिए सभी कंपनी के साथ बातचीत किया और कल ही सभी कंपनी ने अपना रिटेल प्राइस जो 5,000 और 5,000 से ज़्यादा था सभी लोगों ने कम करके 3,500 से कम कर दिया है, जिससे मरीजों को उसका फायदा होगा.
The government has ramped up testing and vaccination drive to deal with surge in cases. With over 15 lakh samples being tested daily, the figures have touched the highest numbers of tests conducted in a single day in the country. A total of 26.65 crore samples have been tested in the country since the beginning of the pandemic. With the aggressive vaccination drive, on over 26 lakh vaccination doses were administered in the last 24 hours. Over 12 crore doses have been administered so far. Bureau Report, DD India.
And Prime Minister Narendra Modi on Sunday held a virtual meeting to review the COVID-19 situation in Varanasi, which is his parliamentary constituency. During the meeting, the Prime Minister took stock of the COVID-19 prevention measures, availability of sufficient treatment to COVID-19 positive patients, the availability of beds, medicines and vaccines in the area. He also directed authorities to immediately provide every possible aid to people to curb COVID-19. During the meeting, the Prime Minister stressed on following "Do gaz ki duri, mask hai zaruri." That's wearing the mask and social distancing is very important, laying special emphasis on providing COVID-19 vaccination to people above the age of 45 years in Varanasi. The Prime Minister directed the authorities to spread awareness among the people to get the vaccine jab.
India is leaving no stones unturned in its fight against COVID-19. PM Modi is taking stock of the situation from time to time. On Sunday, Prime Minister Narendra Modi reviewed the status of COVID-19 in Varanasi through video conferencing. He took stock of the testing, availability of beds, medicines, vaccines and manpower for prevention of COVID-19 and proper treatment of infected patients. He directed the officers to provide all possible assistance to the public expeditiously. Prime Minister emphasized that everybody should follow the distance of 2 yards and use masks. He also said that the administration should make everyone above the age of 45 aware of vaccination campaign and asked administration to extend all possible assistance to the people of Varanasi with utmost sincerity. Prime Minister thanked all the doctors and medical staff of the country and said that even in this hour of crisis, they are doing their duty sincerely. He also said that we have to learn from last year's experiences and move forward cautiously. PM said that as a representative of Varanasi, he is also taking constant feedback from general public. He said that the expansion and modernization of medical infrastructure in Varanasi in last 5-6 years has helped in fighting COVID-19. Availability of beds, ICU and oxygen in Varanasi is augmented. PM also emphasized the need to increase efforts at all levels in view of stress due to the increased number of patients. He said that Varanasi administration should step up pace of work in all the fields in the same way it has rapidly set up Kashi COVID Response Center. And like always, PM emphasized on test, track and treat and said that like the first wave, the same strategy has to be adopted to win over viruses. He also emphasized on providing contract tracing and test reports of infected persons at the earliest. He also directed the administration to discharge all responsibilities towards the patients and their families living in home isolation in a sensitive manner. The public representatives and officials of Varanasi region informed the Prime Minister about the preparations for prevention and treatment of COVID through video conferencing. District Magistrate Kaushal Sharma spoke on the challenges of second wave.
दो चैलेंजेस इस समय सामने आ रहे हैं। एक तो ये कोरोना की जो सेकंड वेव है ये अधिकतर बड़े शहरों में आई है और पूरे देश के लगभग सभी राज्यों में और सभी बड़े शहरों में फैली हुई है। दूसरा सबसे बड़ी दिक्कत ये है कि अब की बार जो भी स्ट्रेन है उसमें ऑक्सीजन की रिक्वायरमेंट लोगों को ज़्यादा हो रही है। ऑक्सीजन ड्रॉप होने के केसेस ज़्यादा आ रहे हैं। जो हॉस्पिटलाइजेशन हो रहा है उसमें हमारे लगभग 99% केसेस ऐसे हैं जो केवल ऑक्सीजन की वजह से वहाँ पे सिम्टम्स आ रहे हैं, उसकी वजह से भर्ती हो रहे हैं। तो ऑक्सीजन की सप्लाई की डिमांड वो पूरे देश में अचानक से बन गई है। तो जितने ऑक्सीजन जनरेशन प्लांट्स वाराणसी के आसपास के हैं वो सीमित संख्या में होने की वजह से ऑक्सीजन की सप्लाई लिमिटेड हो पा रही है, क्योंकि केसेस डेली 2000-2200 और इससे भी ज़्यादा कई बार आ जा रहे हैं। प्रत्येक दिन यही कोशिश की जाती है कि किसी न किसी अन्य जनपदों में जहाँ पे ऑक्सीजन की रिक्वायरमेंट कम हो वहाँ से एक्स्ट्रा सिलेंडर लाके यहाँ प्रतिदिन बेड बढ़ाए जा सके।
Prime Minister was briefed on the issues of control rooms set up for contract tracing, command and control centers set up for home isolation, dedicated phone line ambulances, provision of telemedicine from control rooms, deployment of additional rapid response teams in urban areas, etc. With inputs from Harikesh Bahadur Singh, DD India.
And let's now take a look at the COVID situation across the country.
India continues to battle resurgent COVID-19 as the country witnesses steep rise in new cases. COVID-19 status in India: 2,61,500 new cases were registered in the last 24 hours. 1,501 died due to coronavirus.
The peak is like basically when you take off in a flight, it takes 5 minutes to take off. It goes to plane, and then when you land, it takes more time, 20 to 25 minutes. So similarly, in the peak also, it goes up fast, and it will be at the peak for some time, and it will come down very slowly.
10 states report 78.56% of new cases. Maharashtra has reported the highest daily new cases at 67,123. Uttar Pradesh registered 27,334 cases, whereas Delhi reported 24,375 new cases. In a bid to tackle the massive surge in the number of COVID-19 cases in Maharashtra, Railways has turned 21 coaches into isolation wards at the request of the state government, and there will be 16 beds in every coach. Meanwhile, strict measures have been taken and people in several cities to stay indoor. Police have arrested 2 persons for issuing fake RT-PCR reports to many people.
कॉमन पब्लिक है क्योंकि ये दोनों भी है जो लैब टेक्नीशियन है, इसमें का एक आरोपी है अभी भी एक लैब में सर्विस कर रहा है लैब टेक्नीशियन करके, दूसरा आरोपी जो है उसने जनवरी 2021 से वो सर्विस छोड़ा था और यही काम कर रहे हैं.
Restrictions have been extended in many states of the country to break the chain of the virus. Koraput district of Odisha has decided to seal the borders with Chhattisgarh and Andhra Pradesh. At the same time, Jharkhand Chief Minister Hemant Soren held a meeting with coalition parties to discuss the state of the pandemic in the state, while the Health Minister of Karnataka, K.K. Sudhakar, visited many hospitals and reviewed beds availability and health facilities. Restrictions have been imposed in Kozhikode district of the neighbouring state of Kerala, and orders have been issued to stop the movement of vehicles except essential services. Uttar Pradesh Chief Minister Yogi Adityanath held a meeting with the officials through video conferencing on the current situation in the state. However, all the business establishments in the state were closed on Sunday. Sanitation was completed in Noida and many districts of the state, including the capital, Lucknow. Chief Minister has directed to set up 10 new oxygen plants to ensure oxygen supply in the state.
लॉकडाउन तो महत्वपूर्ण होगा. पिछले बार किया था, कुछ लोग ने थोड़ा उसको नहीं समझा ठीक से, मगर मुझे लगता है कि लॉकडाउन बहुत आवश्यक है और इसके होने से साथ साथ में हमारे जो स्वास्थ्य सेवाएं जो जिसका हम टेस्टिंग करते हैं, जिसका हम एडमिशन करा रहे हैं, ICCC के माध्यम से पेशेंट्स को पूरा संचालन कर रहे हैं, एम्बुलेंस को एक साफ सुथरा रास्ता भी मिलेगा.
Weekend lockdown continues in Delhi. Bazaars including parks remain closed. Chief Minister Arvind Kejriwal said that less than 100 ICU beds are currently available in the state and infection is rising at a very high speed. He has requested the central government to provide health infrastructure.
ज़्यादा चिंता की बात यह है कि पिछले 24 घंटे में पॉजिटिविटी रेट बढ़ के लगभग 30% हो गया है. ICU बेड्स की खासकर काफ़ी कमी हो गई है. लगभग सारे दिल्ली के ICU बेड्स मिला के 100 से भी कम ICU बेड्स पूरे दिल्ली में बचे हैं. हम लगातार केंद्र सरकार के संपर्क में भी हैं, उनसे भी मदद मांग रहे हैं, उनसे मदद मिल रही है. जो मदद अभी तक हमें उनसे मिली है उसके लिए हम उनका शुक्रिया भी अदा करते हैं.
There are reports of 12 patients dying due to shortage of oxygen in Shahdoll of Madhya Pradesh, but the district administration has denied the fact.
ऑक्सीजन के नहीं होने की वजह से कोई डेथ नहीं हुई है. सुबह 8 बजे तक जो अस्पताल अधीक्षक डॉक्टर नागेंद्र सिंह ने मुझे बताया था कि सुबह 8 बजे तक 6 डेथ रिपोर्ट हुई हैं और वो 6 डेथ ऑक्सीजन की कमी के कारण नहीं हुई है. वो डेथ क्रिटिकल पेशेंट थे जिनको कोमॉर्बिड था, उनकी वजह से हुई हैं.
With the resurgent virus taking bigger toll and increasing pressure on medical services in the country, the need of the hour is to follow COVID-19 prevention measures and behavior. We need to make sure to apply masks, avoid crowded places and take special care of hygiene. Only then the war can be won from this pandemic. Bureau Report, DD India.
So that's what the various states of the country look like on Sunday when it comes to battling the pandemic. Let's now take a look at how the world is battling this pandemic.
The world continues to grapple with COVID-19 pandemic. Surging numbers of cases along with restrictions as well as speeding up of vaccination programs in many parts of the world is a renewed effort in battling the pandemic. Moving to Southeast Asia, in Thailand, bars and restaurants have been shut down ahead of restrictions imposed on Sunday to curb with a surge in COVID-19 cases. 2 weeks of restrictions on restaurants are in place. At the same time, 59 provinces are classified as orange. In Italy, from stagehands to waiters and waitresses, hundreds of those working in Rome's entertainment and hospitality industry on Sunday pleaded the government for a lifeline as the country prepares to reopen. Beating empty black storage trunks used in concerts and theatres, the workers gathered in Rome's Piazza del Popolo to dramatize their demand for a government fund to help them survive. Germany held National Memorial Day on Sunday for its nearly 80,000 victims of the coronavirus pandemic. German President Frank-Walter Steinmeier and Chancellor Angela Merkel attended memorial events just as the country battles a renewed surge in COVID-19 cases. Israel revoked outdoor coronavirus mask requirement as a sign of the country's return to relative normality, boosted by a mass vaccination campaign against the COVID-19 pandemic. With about 81% of citizens or residents over 16, the age group eligible for the Pfizer-BioNTech vaccine in Israel having received both doses, contagions and hospitalizations are down sharply. But entry by foreigners is still limited, and non-immune Israelis who return from abroad must self-isolate due to concern virus variants could challenge the vaccine. The COVID-19 pandemic in Bangladesh continued to break its own record with 102 deaths reported from the country on Saturday. The government has ramped up measures to fight the pandemic and provide relief to the poor people in the country. Health Minister Zahid Malik inaugurated the largest COVID-19 hospital in Dhaka on Saturday. The COVID-19 dedicated hospital of the Dhaka North City Corporation has a capacity of 1,000 beds with 212 ICU beds, 250-bed HDU and a COVID emergency unit with 50 beds. With Bureau Report, TD India.
And that brings to our In Focus tonight. The government takes key decisions to tackle the COVID surge. Well, the surge is there. The government is doing its bit. It's taken some key decisions which we told you about. And to discuss more on that, I am joined on the show by Dr. Randeep Guleria. He's the director of All India Institute of Medical Sciences in Delhi, and also Dr. Ashok Seth. He's the chairman of the Fortis Escorts Heart Institute and Research Center in Delhi. Both gentlemen, many thanks for joining me on the show. Dr. Guleria, to you first. Over 1,500 deaths in the last 24 hours. More than 250,000 cases so far. 15 million confirmed cases. ICU beds, shortage of ICU beds, of oxygen cylinders, medical infrastructure under a lot of stress. The situation indeed is very grim. What can we as a society do to deal with this, the situation we have on our hands, and what do you think is the way forward?
So the situation is troublesome, it's grim because the number of cases are increasing day by day. In many parts of the country, we're seeing that the positivity rate is very high. In Delhi, it is even close to 30%, which itself is meaning that the virus is spreading rapidly in the community. Therefore, two things need to be done, or we need to have a multi-pronged strategy. The first thing is we have to work as citizens, as a group, to stop the spread of the virus. And that is why COVID-appropriate behavior becomes more and more important. People should stop going out if they have non-essential work to do. On the other hand, they should try and work from home as much as possible. We must also work on strategy of testing, tracking, treating and isolating so that everyone who is positive, his close contacts are tracked, they are isolated so that the chain of transmission can be broken. If you find that there is a large cluster of cases, that area needs to be converted into a containment zone. If you're finding that the case positivity rate in a certain area is very high, that area needs to be converted into a containment area, and no one should be allowed to go out from that area. Everyone in that area should be tested, they should be treated, tracked, and they should be isolated so that the infection doesn't spread to other areas. So that is very important. Along with that, the vaccination drive is already going at a high speed. We need to try and improve it as much as we can. And the third thing that we need to do is, because as the cases increase, the demand on hospital beds, ICU beds, oxygen points will go up. We need to work aggressively like we were doing 6-7 months ago of building more and more COVID care centers, COVID hospitals, COVID ICUs, so that we can manage the increasing surge of cases that are coming and will come in the coming few weeks.
Okay. Dr. Ashok Seth, let me bring you in. Dr. Seth, what changed in the past few days or weeks that situation came to such a pass where we are dealing with a situation that has brought our whole society to the brink of grimness, where the health infrastructure across the country is sort of collapsing. We can see visuals on our social media floating around where people are dying of lack of oxygen, where the government needs to call in last-minute meetings to say, let's quickly ramp up oxygen supply, production facilities and things like that. How did the situation come to such a pass?
So let's clearly understand that, yes, you're right, the healthcare system is getting overwhelmed. And I don't want to actually talk about, I'm talking about as a doctor, not as a civilian. We don't want a blame game around this because everyone's in some way responsible for where we are. Let me just first say that while we knew that the second wave was to come, I must confess myself, even fighting this battle from day one as a healthcare warrior, never expected that the second wave, which was we expected all to come, would be so vicious that it could be variants of the virus, which would multiply so rapidly that within a few days, the numbers would rise to such a level to overwhelm the system. So most of the time that everybody thought was that there'll be a slow surge up again, and we would have time enough to again reassemble our resources. But there are 2 or 3 other important points. We may say that there was COVID fatigue and the public was actually having fun time after unlocking and enjoying ourselves and having parties and going out. But by the way, fatigue is a normal psychological phenomenon. And yes, people did get lax, but then I'm to blame for it, so is everybody else. And certainly having super spreading events, having the situation where we exhorted across the world how we had really conquered the virus. We thought that the virus had gone away. We became complacent, careless, and that sort of thing happened perhaps across the board. It was not just the public, so let's not just blame the public alone, but it actually happened across multiple systems and policymakers as well. So many of the things which got created, many of the centers which got created were actually de-escalated with a thought process that we would escalate it as the second wave arrived, but this is too rapid, too fast. So I want to actually more dwell on, this is the time for everybody to forget the past. Let's not go into who was responsible and how did it happen, but more so, what do we do now? And this is a war. Everybody's in it together. Whether it's public or private, there is no differentiation. Whether it's policymakers or doctors, there is no differentiation. Whether it's public, we all need to go out there and stop the spread of the virus. And Dr. Guleria has comprehensively identified the 3 strategies which are needed. It's a multi-pronged approach, but I would just more practically put it to the point of the public. And may I suggest to the public that you are the ones, I'm the one who can actually stop the spread of this virus as of now, as of today. We talk about masking, and you all have 80% of the population has a mask on. But unfortunately, this mask is around the neck. It's sometimes around the mouth. It's never up on the nose. In fact, I'm emphasizing to you all that it's no more time of masking, it's time of double masking. You see, we actually have these cloth masks. 99% of the public is wearing cloth masks. It's good, but with the concern that there may be airborne spray, which has recently come up, the fact is that the cloth masks only stop us from acquiring the virus or protect us or protect somebody else up to 40%. So it's better than nothing, but it's only up to 40%. If we add on, and I say double masking, this is the 3-ply surgical mask, which costs 2 rupees at the moment. But even when we wear this, and you've seen many people wear this, you will see that there are holes around it. It was never meant to protect us from viruses. It was only meant so that we did not cough on the patient and didn't have droplets on the patient. So if we actually combine this in a manner that we actually have it tied on the side, we actually are able to get the best out of this mask. And if we then just put a cloth mask over it, we actually can get an 85% protection by doing this. And this is with a cloth mask and a surgical mask. And this for 85% protection means more than a 95% protection
Ashok Seth,
from each other.
Dr. Ashok
This is so important that if we can only put this into practice, we would move multiple stages ahead in combating the virus. And this is what everyone should do from here on. Don't go out unnecessarily, don't congregate, lock yourself in, don't panic, be sensible, and remember, you owe this to yourself, you owe this to the community, you owe this to your family, and you owe this to your parents to be safe and not spread the infection.
Absolutely. Dr. Seth, you make a very important point. And let me talk to my viewers directly here. You know, when anchors like me sit in studio and put out these reports that this is the number of total people deaths today, this is more than 250,000 of people got infected today itself, these are the number of cases, 30 lakh people have died around the world. These figures are true. But the idea, as Dr. Seth says, is not to just get scared and overwhelmed by it. These figures can come down if we follow the COVID protocols. Dr. Seth, you made a very important point. Can I request you once again to demonstrate to us very slowly how to do double masking for the benefit of my viewers?
Thank you. And this has been, by the way, studied and proven and recommended by CDC early on this year when United States was increasing its numbers. See, this is while I have N95, and those who can afford an N95 mask, which has got down in price, definitely wear N95, and that doesn't require double masking. But you still see that the majority wear the cloth mask, which can be easily washed, so that is right. This surgical mask costs 2 rupees and can be thrown at the end of the day. It only means 60 rupees a month. But this, when we wear it, and you've seen many people wearing it, has holes here and holes here. So you feel that you're actually protecting yourself, but the protection is only 40% because it was never meant to protect a person. It was meant so that when we wear it while doing an operation, we don't cough on the patient or and keep him sterile. Now you can see that if I actually tied the ends of the mask, I actually make it, and this is just a knot at the end of the mask, I actually make it far more fitting than the previous mask which I showed you. And it's still a sterile surgical mask, and now you can see it has no holes. Now if I just put a cloth mask over it, and that's my usual cloth mask, and here it is, you see how much of a ceiling I have actually around me. So what that means is that even a surgical mask and a cloth mask can give you a 95% seal as good as an N95 mask. And this is throwable at 2 rupees a day, and this is washable, and you're actually doing service to yourself and to others. 85% protection is what you get from others coughing over you, and 95% protection is get if 2 people are doing double masking. Now that is as much as we get from an N95 mask. So distancing and even avoidance of closed spaces, especially as we are more worried this time about the airborne spread, good ventilation and double masking. That is what is going to save us, and learn to do this and do this for your own selves and for your family.
Very important point you make. So Dr. Seth makes an important point. Do a double masking, use a disposable mask, surgical mask. Try that not the way he told you. It'll protect you more. Put a cloth mask, preferably use a N95 mask. If you can, that's slightly more expensive, but even if you cannot afford or do not wish to go in for an N95 mask, if you do this double masking, it protects you to about 95%, as Dr. Seth tells us. As Dr. Galeria also pointed out, you know, we have to follow the COVID protocols of ensuring or adhering to social distancing, as the Prime Minister today himself said, reiterated many number of times that it is do gaz ki duri, mask hai zaruri, keep that 6 feet distance. It will give you a lot of protection, and we will be out of the situation where we are, because we are heading to a situation where people are going to hospitals, but hospitals cannot take them in. They do not have the infrastructure enough. So we have to, and that infrastructure cannot be created overnight. The government is ramping up, production of oxygen cylinders, but remember that takes time. Governments can give approvals. The governments can, fast track that, but that does take time. The railways can say we are ready to, put down liquid oxygen, transport that, but remember that takes time. Unless I play that role, will take a while, and by that the price that we'll have to pay is far too way too more than we can reduce by following these simple things. Dr. Guleria, let me come back to you. One, I want to clear the air on the N95 thing. Is N95 recommendable? Because in the beginning they were saying that, well, N95 is not necessary. What is the latest on that?
So N95 mask is probably the best that one can use, and it's pretty strong. The issue was that it was not being recommended in the past because of the fact that there was a shortage and it was not freely available, and it was felt that it should be reserved for those who are actually coming in close contact with COVID-19 patients, and that is the healthcare workers. That is why the initial strategy was that for healthcare workers, they could use an N95 mask, especially for those who are working in the ICU or in the hospital where you are looking after COVID-19 patients. And for those who are working in, who are not working in hospitals or the ordinary public, a cloth mask would be useful. There has been debate over the last 7 months regarding the transmission route as far as COVID-19 is concerned, whether it's droplet or whether it's aerosol. There is a feeling that there is also an aerosol transmission, and that may be something which is contributing to the rapid spread as we are seeing right now. And that is why good ventilation is key. Once you're sitting inside, it's not only that you have to have a 2 gaz ki duri, you may have a person who may be even further away, but if he is coughing, the virus may stay in the air for a longer period and you may be exposed to that and get the infection. Therefore, in a closed area, cross ventilation is very important. Keep your windows open so that there is good air exchange and the virus which is there in the air is taken out and doesn't stay in the closed environment.
Dr. Guleria, could I request you to
there is now the concept of double masking. If you're wearing an N95, you don't need to double mask yourself. If you are going to an area, then you should have a surgical mask and over that a cloth mask. But please make sure that your mask is tight around your nose and your cheeks. Very often people have a loose mask, and then if air goes in from the side of your nose or your cheek, then the mask loses its efficacy. So it should be a tight fit around your nose and your mask. There is some data now which is emerging which says it suggests that if you don't have a surgical mask, you will still get some efficacy. It may not be at that high, but it is reasonably good. Even if you wear 2 cloth masks, one on top of the other, but make sure that it is tied tightly so that it protects you throughout. So in case there are people who are not able to get a surgical mask, please use 2 double-layered cloth masks. That will be better than a single one. But the most important thing is to make sure that it forms a tight seal around your nose and mouth. So these are very important things that we need to keep in mind.
Okay. Dr. Guleria, I want to come back to the point you were making about ventilation. You were talking about the transmission route, about aerosols. Could you explain that in layman terms, what it means?
So when we were talking initially of COVID-19, we said bulk of the transmission occurs through droplet. Droplet means that these are droplets of where the virus is there, and these are of larger size. So they don't travel far and they drop down onto the surfaces, and that is why there was a lot of focus on cleaning surfaces, doorknobs, tabletops and others, because the virus would drop onto the surfaces and then you touch those surfaces, you could get infected. But now there is more and more data emerging that besides this, the virus can also be what we call aerosol, that is smaller size air droplets, which is less than 5 microns, which can stay in the air for a longer period of time and they don't drop down. So you have a person who's coughing in a room, he's far away from you and he moves out. The virus stays in the air for a long time, and now if you are not wearing your mask and you cross that area, you can get the infection by crossing that area where the virus is still there in the air. To prevent that, wearing a mask even when you're inside, indoors is important, and also making sure that windows are open so that there's good air blowing, so that even if there is a virus in the air, it is blown out into the sun where it will die, and you will not have contamination or a chance of infection while you're inside the room. So if you are working in your office, make sure your windows are open, make sure that the ventilation that you have, if you have an AC, that is a good duct so that there is a lot of fresh air coming in and there is good cross ventilation. So indoor environment is becoming more and more important in terms of fresh air coming in rather than having a closed environment, because in a closed environment like an office space or a hall, if you have one infected person and the area is not well ventilated, many people can get infected even if they are maintaining physical distancing.
Okay. Dr. Seth, I want to bring you in. Good you veered the discussion towards that, because this sort of discussion is what really is needed today for people who are worried. But as you say, they don't need to be overwhelmed by it. They just need to be aware of it and then play their part. A lot of people ask this question, that if I test positive, the authorities say stay at home, don't go to the hospital unless really required. People ask me, when do we go to the hospital? What is the time to decide that now I need to go to the hospital, when it's not too early and not too late for the hospital to save me?
So I think it's a very important question. And by the way, I'd also want to emphasize that we're getting at least 50 to 70 phone calls a day. And a lot of them are panic also, where people are uncertain about coming in. They want to come in because they feel that perhaps getting admitted is a life-saving procedure. It also, they're worried about that they may not get beds later, and therefore you've asked a very important question. And we say, firstly, let me emphasize the fact that 90% of the people would get better. And especially younger people more so would get better from this. It's almost like a flu infection. Yes, those with comorbidities, virulence, those who've had other, on immunosuppressants, elderlies, those are comorbid conditions which cause serious illnesses. And finally, I'll also say that those who are vaccinated are less likely to have serious illnesses and certainly unlikely to have a death from this virus. So where is the whole issue? Because most would get better, very well, cool, calm, they clearly outline that all you got to do is be positive mentally, breathing exercises, good habits, eat well, sleep well, isolate yourself, and measure your oxygen saturations, and stay in touch with a doctor. And that's all you need to do to get better. Yes, there are other drugs that we give. We still don't know how much benefit they provide, but we actually have a protocol of giving some medicines at home. Now, I must tell you that the measurement of saturation is great, because earlier we used to say if you drop your saturations to less than 94%, and by the way, saturations are easily measured at home. By this time, we've talked about pulse oximeters for the last 1 year. It's been available to everybody, and perhaps everybody's got this. Anybody who gets COVID-19 will have a pulse oximeter or should get a pulse oximeter. It just goes around the finger and you can actually see your oxygen saturations. And earlier on, we used to see anybody who drops his oxygen saturations to less than 94 means that that's a criteria for admission. We don't say that anymore. We know that 93, 92 saturations can be treated at home. There are protocols defined for that. There is now video conferencing and consultation with specialists and with physicians all the time happening from every hospital, and that's a norm at the moment. So care at home has become greater. We know more about the virus. We know more about the type of test to be done, what is going to predict a worsening situation, and we know when to get the patient into hospital. So please don't panic. And finally, you should always be, if you're at home and being looked after at home, as the tests are advised, steam inhalation is important. Walking around, a 6-minute walk in your own room in isolation and measuring your oxygen saturations at that time is an important factor. In fact, that tells you your ability of your lungs to be able to, able to ventilate yourself and oxygenate when you exercise. And if that level stays beyond the 93 level, you're actually doing fairly well. And finally, breathing exercises, meditation, staying positivity is most important. Now, when you start dropping your oxygen saturations to 92, 91%, you feel dyspneic, you feel breathless. Well, certainly, because you're in touch with the doctor, we would get you into the hospital. But that's the time when we believe that the second-line agents may come in. That's the time when we do a chest X-ray, and certainly that's the time, if we find that your oxygen saturations drop, is we would also do a CT scan if needed. But remember, CT scan is not a front line. Many people, the moment that a test comes positive, can I have a chest X-ray? Can I have a CT scan? Remember, it's a flu-like illness. And how many times all of us have had a common cold or a flu? That is what it is. Unfortunately, some get serious, and less than 1% or 1% to 2% may die. And that is why we're so cautious about it. But otherwise, there is no panic about it. And certainly in the younger people and actually those who have not got comorbid conditions, it usually passes off safely. In fact, there are a number of asymptomatic people who will have COVID positive, and the test will show COVID positive, and they're being tested for some as a contact from another person or so on and so forth, who will not even demonstrate a symptom and would recover over a period of 7 to 10 days and turn negative and yet not have any symptoms at all. So no panic around these things. Yes, interaction, close supervision, video conferencing with a physician, and that's all that's required.
All right. Dr. Seth, many thanks that you've in detail told about us. Dr. Guleria, the last word to you. When do I go in for testing? Once I get tested positive, what are the step-by-step protocols that I need to follow? Dr. Guleria, please.
Tested positive, it depends on what your saturation is. There is no need to panic, as we have been saying, and as Dr. Seth just said, that almost 85 to 90% of people will have mild disease or asymptomatic disease for which really no treatment is required, except supportive treatment in the form of paracetamol for fever and good hydration. So there should be no panic. And if you have comorbidities, you must then consult your doctor. Otherwise, you should home isolate yourself if you have facilities for home isolation so that other members don't get the infection. You must have a separate room and an attached toilet, and you must follow the protocols which are on the ministry website. If your saturation tends to fall, or if you find that you have high-grade fever or you're becoming breathless, then you must consult your doctor, and then based on your symptoms, one could either get blood tests done or some investigation, and if there is a need, then only you need to be admitted. The number of people who need to be admitted is less than 15% of the total number of people who become positive, and only 2 to 3% will require ICU care. So it's very important for people to understand that majority of them can be managed at home, and this require only symptomatic treatment. You don't need to rush and try and get drugs like Remdesivir or start steroids or start thinking of getting plasma. You will not need anything. You just need to take your paracetamol tablet for fever, keep yourself well hydrated, do your regular exercises. You could do some yoga, and you will come out within 7 to 10 days.
All right. Dr. Randeep Guleria, Dr. Ashok Seth, you make a very important points. Many thanks, both gentlemen, for being on the show. Hope when you're watching this, you follow this. It's very, very important to follow, and the idea is not to panic, but to act wisely, save ourselves, and if we do get into the unfortunate situation of contracting COVID, then deal with it calmly and follow the steps which the doctors have laid out. Many thanks, Dr. Guleria and Dr. Seth, for joining us. And moving on, the Union Home Secretary has written to Chief Secretaries of States and Administrators of Union Territories on Sunday that they should issue necessary instructions to all authorities concerned in the states and UTs to take necessary measures to prohibit the supply of oxygen for industrial purpose, except in 9 industries as stated in the letter of the Union Health and Family Welfare Secretary dated 18th of this month. This is in keeping in view with the rapid rise in COVID-19 cases in various parts of the country and the resultant rapid demand for medical oxygen, particularly in high burden states of Maharashtra, Madhya Pradesh, Gujarat, Delhi, Uttar Pradesh, Chhattisgarh, Karnataka, Kerala, Tamil Nadu, Haryana, Punjab, Rajasthan. Campaigning for the 6th phase of elections in West Bengal is underway in full swing. Political parties are busy wooing voters. On Sunday, Union Home Minister and BJP leader Amit Shah and the Chief Minister of the state, Mamata Banerjee, held rallies and road shows in the poll-bound state.
Campaigning for the remaining phases of West Bengal elections is underway in full swing. Political parties are busy wooing voters. Union Home Minister and BJP leader Amit Shah on Sunday held 2 rallies in the poll-bound state of West Bengal. Addressing public rally in Purba Bardhaman in West Bengal, he slammed the ruling TMC government for not using central government's funds for farmers' welfare.
मोदी जी देश के हर किसान को प्रति साल 6,000 रुपया भेजते हैं, 3 साल से भेजते हैं। 18,000 रुपया देश के हर किसान को मिला, बंगाल में नहीं मिला। दीदी रोक कर बैठ गई है। वो कहती है कि मोदी का पैसा नहीं चाहिए। अरे दीदी, ये मोदी जी का पैसा नहीं है, ये पैसा बंगाल की जनता का पैसा है। आप काहे को उनको नहीं देती हो?
Addressing a rally in Swarupnagar, he said that CAA will be implemented in the state after Mamata Banerjee's farewell on May.
दीदी कहती है हम CAA नहीं आने देंगे। अरे दीदी, तुम क्या CAA को रोकेगी? 2 तारीख को आपकी विदाई निश्चित है और उसके बाद CAA आने वाला है। मैं आज आपको वादा कर कर जाता हूं कि आप 2 मई को कमल फूल की सरकार बना दो। हर एक शरणार्थी को गले लगाकर सम्मान के साथ नागरिकता देने का काम ये भारतीय जनता पार्टी।
Amit Shah also held back-to-back 2 road shows in Nakshipara and Habra in the state. West Bengal Chief Minister and TMC leader Mamata Banerjee held road shows and addressed rallies in poll-bound district of the state. People will get ₹5 lakh annually for availing free treatment at private hospitals, AIIMS or at any government hospitals. People will also get free of cost medical treatment in the state. Meanwhile, Election Commission of India has imposed a ban on Trinamool Congress candidate Sujata Mondal and BJP Sayantu Das from campaigning in the state for 24 hours. Out of 8 phase polling, 5 phases voting has already been conducted in the state. Campaigning for remaining 3 phases is on. Counting of votes will take place on the 2nd of May. Bureau Report, DD India.
And let's now take a look at what else made news around the country in our segment National Wrap.
The National Testing Agency has postponed JEE Main's schedule to be held from 27 to 30th April. Union Education Minister Ramesh Pokhriyal Nishank said that the examination has been delayed in view of the prevailing COVID-19 situation across the country. The NTA has said that the revised dates would be announced later on and at least 15 days before the examination. Uttar Pradesh Additional Chief Secretary for Information Navneet Sahgal has said that sanitization work has started in entire state. He stated that it is also being ensured that the migrants coming from outside are kept in quarantine. Sahgal added that the migrant would be tested for COVID-19. If they are found COVID positive, they would be treated at quarantine centers. Mumbai Police Commissioner Hemant Nagre has said that the Mumbai Police has issued color-coded passes for vehicles providing essential services in the city. Red color passes will be for all medical staff, green for food and yellow for other essential services. A team of Bhopal Crime Branch has arrested 4 people for selling Remdesivir injections in black market. During the investigation, the 4 accused revealed that they had purchased injections at 7,000 rupees each and were trying to sell them at 12 to 18,000 rupees per piece to those in need. The National Investigation Agency has declared a reward of 7 lakh rupees for the arrest of Madhavi Hidma, who heads the People's Liberation Guerrilla Army PLGA Battalion 1 of the Maoist. The reward has been announced in a 2019 case pertaining to the killing of Chhattisgarh legislator Bhima Mandavi. The PLGA was involved in the 3rd April ambush at the Sukma-Bijapur border, where 22 security personnel were martyred. 5 people died in a road accident near Pakhi on Uttarakhand Joshimath Badrinath National Highway. A vehicle returning from the wedding went out of control and fell into a gorge, leaving 5 people dead on the spot. As soon as the administration came to know about the incident, a SDRF team was rushed to the spot and the rescue work was started.
And that's it then in tonight's Newsnight. Thanks for watching. Namaskar.
Kitchen waste, green waste, dried leaves from the garden, which are a source of carbon.
The money we received from the government added to our savings all went into the rice mill. I was into athletics before going in for judo, which really attracted me. It is a wonderful sport for girls and very beneficial.
Being the leader of a small Caribbean island with a population of 72,000 people, I did not fancy my chances of getting such a swift, positive response to my request of India's Prime Minister Narendra Modi. One would have thought and understood that in a global pandemic such as this, a nation's size and might would have been the primary considerations. But it is to the credit of Prime Minister Modi that our request was considered on merit and the equality of our people was recognized. I'd like to take this opportunity once again to express my heartfelt thanks and appreciation to Prime Minister Modi, his government, and the citizens of India.